Dear colleagues, Assalamu alaikum wa rahmatullah. Thank you for the opportunity to speak about our study, the study that has not been published. So I'm going to show you some preliminary data, and hopefully soon you'll be able to read the full data once it's published. So this study was a national study in Saudi Arabia examining the effectiveness of insulin pump therapy during the month of Ramadan, as well as assessing fear of hypoglycemia. These are my disclosures. So I'm sure everyone in the audience is aware of the month of Ramadan and how it can be very challenging for people with type 1 diabetes when it comes to them attempting to fast due to the increased risk of hypoglycemia, hyperglycemia, diabetic ketoacidosis, and dehydration in these individuals. Most people with type 1 diabetes are considered moderate to high risk and are essentially exempt from fasting, yet the majority of them, at least in Saudi Arabia, still insist on fasting and attempt to fast during the month of Ramadan. And we're all aware of the IDF DAR guidelines that you could utilize to assess the risk of your patient for fasting and counsel patients about the decision on whether to fast or not. So on these in these guidelines and risk calculators, you could see that when it comes to modality of treatment, basal bolus and insulin pump users are scored or given a score of 2.5. So one of the objectives of this study is to see if we probably may need to reconsider the grouping of insulin pump users with MDI users when it comes to risk stratification. And I say this because some of the recently published studies from our group and others, and also because we know that advances in insulin pump therapies, including the introduction of the automated insulin delivery system, have remarkably improved glycemic control, satisfaction with treatment, and quality of life in people with type 1 diabetes. We know that compared to users of MDI and other treatment modalities of diabetes, AID users often have better glycemic control, less hypoglycemia, less hyperglycemia, and they often enjoy a more flexible lifestyle. So this is outside of Ramadan. We believe that even during the month of Ramadan, based on some of the data that have already been shown in this conference and other conferences, and some of which are already published, that users of the automated insulin delivery systems tend to be able to fast more days of Ramadan, tend to have better glycemic control during the month of Ramadan. What we don't know is whether these individuals have better satisfaction, less fear of hypoglycemia during and after Ramadan. And this is one of the things that we looked into in this study. So our main question was, is the use of AID technology in real-world settings associated with a better fasting experience and improved glycemic control compared with other modalities of type 1 diabetes treatment among those who attempt to fast during Ramadan? And what we assessed in this study was the following. So number of days fasted or fasting was broken due to diabetes, rates of acute complications during Ramadan, glucose control during Ramadan, and lastly, level of fear of hypoglycemia after Ramadan in these individuals. So I'm going to show you some of the data. As again, these are preliminary data. The full data will be presented in a few months and hopefully will be published. So this is a prospective non-interventional national study in 5 regions in Saudi Arabia that we conducted during Ramadan 2024. We've had collaborators, some of which, or some of whom are among the speakers today, and they were from Riyadh, Medina, Jeddah, Asir, and Al-Ahsa. A total of 411 patients with type 1 diabetes using CGM and attempted to fast during Ramadan 2024 were recruited to the study. 210 of them were using MDI and CGM. 156 of them were using automated insulin delivery system. 36 of them were using sensor unintegrated with the pump. So, for example, Medtronic pump with a Freestyle Libre sensor. So the sensor and the pump are not talking to each other. So there is no automation of insulin delivery. And then the fourth group was a special group who were using sensor augmented pumps with predictive low glucose suspension. So these are patients who are using an older version of insulin pumps where the sensor is integrated with the pump, but there is no automated basal insulin delivery. What these systems has or have instead is the suspension before low. So it protects against hypoglycemia, but it doesn't do much when it comes to hyperglycemia. And these are the definitions of these groups that I just went over. So what did we evaluate in these individuals? So the main endpoint was the number of days when fasting was broken due to diabetes or because of diabetes-related causes. We've also assessed the rates of acute complications during Ramadan, so rates of hypoglycemia, hyperglycemia, DKA, diabetes-related hospitalization, diabetes-related ER visits. We also assessed the glucose level. So all of our study participants were using continuous glucose monitors. And then at the end of Ramadan, we assessed their level of fear of hypoglycemia, as you're going to see. These are the baseline characteristics without going into details here. They were comparable essentially, except when it comes to insurance. And you could see what you would expect, that most of those who were using the automated insulin delivery systems were insured, so 61% compared to the low insurance rate in the other groups. So what happened to glucose levels? So similar to what we showed 2 years ago in one of our papers, where the AID system users having the best time and ranges. So best time in range, best time above range, lowest time below range, compared to the MDI sensor unintegrated pump and sensor augmented pump. So AID users had the best glycemic control, 73% time in range, 25% time above range, 1% time below range, and so on. And also GRIs, which is they had the lowest GRI, which is one of the most recent metrics used by our group and others when it comes to assessing glucose control. So what about acute complications? So some of the data will be released soon, but on this graph, I show you the proportion of patients who achieved the double target of fasting. So this is a target that we assign to those who were able to fast most days of Ramadan. So they only broke their fasting 2 or less days per Ramadan. And they also maintained a time and range greater than 70% during Ramadan. So then the second main part of this study, which is also new and explored for the first time, is the level of fear of hypoglycemia after Ramadan by modality of treatment. So we've used the hypoglycemia fear survey, the updated one, which includes 15 behavioral questions and 18 worry-related questions. So to give you some idea, so these are the behavioral questions. So we ask individuals in terms of how many or how would you rate your behaviors when it comes to trying to avoid hypoglycemia and its consequences in the past 6 months. And they can score or give themselves a score from 0 to 4, 0 being never and 4 being almost always. So do you eat or did you eat large snacks over the past 6 months to minimize hypoglycemia? And just to highlight one point, so in this survey, we asked them about their behavioral questions during the month of Ramadan. So this is a typo. It should be during the month of Ramadan and not in the last 6 months. So patients were evaluated for their behaviors when it comes to minimizing risk of hypoglycemia during Ramadan. And also they were asked about their worries of hypoglycemia during the month of Ramadan. So questions such as, I get emotionally upset and difficult to deal with. I'm concerned about this as being a symptom of hypoglycemia. I'm concerned about no one being around me to help me during hypoglycemia episode. So is this a feeling that the patient almost always has, or is it a feeling that the patient never had? Then based on this, we could give patients a low worry score or a high worry score. So then we looked at how these patients did when it comes to their worry and behavior, and we examined their glucose control during the month of Ramadan by stratifying it by their scores. So what you could see here is that patients who had high behavior score on the hypoglycemia fear survey, they were the ones who had the highest time below range and the higher and the lowest time in range during Ramadan. So it seems as if the time below range during Ramadan is strongly associated with high behaviors that patients do during the month of Ramadan to minimize risk of hypoglycemia, which makes sense. So if you are having higher rates of hypoglycemia during Ramadan, I would expect that patient to have behaviors or more behaviors that are related to avoiding hypoglycemia. And this is shown very clearly in this study and for the first time. And the same is somewhat true when it comes to worry, although you do not see statistically significant differences when it comes to worry. And we believe that this is because the majority of these individuals had high worry score to begin with. And if you look at the predictors of this, so, or if you compare these characteristics by level of score, I want to point out the modality of treatment section of this table in the bottom, where you see the AID users having the lowest proportion of patients with high behavior score, but not really worry score. So the percentage of those with high worry score was high across the groups, which makes sense. So it seems as if these patients, so they almost all worry about hypoglycemia, but the ones who are on AID, they were less likely to do behaviors to avoid hypoglycemia. And finally, when you look at the predictors of fear of hypoglycemia, you could see that those who had severe hypoglycemia during Ramadan were 4 times as likely to have high behavior score. And those who had severe hypoglycemia during the month of Ramadan were 5 times as likely to have high worry score during Ramadan compared to those who did not have severe hypoglycemia. So it is very clear that severe hypoglycemia events during Ramadan increase the risk of fear of hypoglycemia, whether it's the behavior subscale or the worry subscale of the score. Severe hypoglycemia events lead to higher fear of hypoglycemia after Ramadan. So in these data, and I've shown you just part of the data, use of AID during Ramadan was associated with fasting most days of Ramadan, best glycemic control, and the least frequent hypoglycemia avoidance behaviors. The IDF diabetes or IDF DAR Alliance risk calculator may need to be updated to assign a lower score for AID technology compared to MDI when used by people with type 1 diabetes during Ramadan. This is based on their ability to fast more days of Ramadan, their better glucose control during the Ramadan, and the lower rates of severe hypoglycemia during Ramadan, which is associated with increased fear of hypoglycemia after Ramadan in these individuals. So with this, I conclude, and I thank you for listening.